Greetings, everyone. My name is Shannon Arnette, and today I am presenting my Doctor of Nursing Practice scholarly project titled Reducing Depression in Nurses with Online Interventions. Thank you for being here. First, I'd like to extend my sincerest gratitude to my committee members for their support, feedback, and guidance throughout this scholarly project. Thank you, Dr. Condon, Dr. Sumner, Dr. Theo, and everyone who contributed to this project's success. Depression is one of the most common mental health disorders worldwide and affects roughly 1 in 6 adults during their lifetime. The American Nurses Association found that 40% of nurses reported depression symptoms in the year of 2021. One study found that 70% of nurses in tertiary care settings reported feeling depressed. Nurses are at an increased risk for depression for many reasons, including chronic stress, staffing issues, long shifts, workplace violence, burnout, rotating shifts, and compassion fatigue. These stressors not only affect nurses' mental health, but can also worsen turnover, absenteeism, and the quality of patient care. Nurses also experience unique barriers to care, making obtaining mental health treatment difficult. Rigid work schedules, exhaustion, financial issues, insurance problems, and mental health stigma can prevent nurses from accessing traditional mental health care. Because nurses are essential to healthcare, improving their mental health has a positive ripple effect. Healthier nurses contribute to safer patient care, better collaboration, improved staff retention, and stronger healthcare systems. With this line of thinking, I developed the clinical question that guided my project. Can a web-based intervention reduce depression severity in nurses? The primary aim of this quality improvement or QI project was to reduce depression symptom severity among nurses using a free, self-guided, web-based cognitive behavioral therapy or CBT workbook. There were also several secondary aims of this project. These were to improve access to effective care, reduce the economic burden associated with unmanaged depression, promote nurse well-being and resilience, and lastly, improve patient and system outcomes through a healthier workforce. I designed this project with a focus on both individual wellness and a broader organizational impact in mind. Before implementing the project, I reviewed 13 primary research studies. 4 major themes consistently emerged. First, web-based and self-guided CBT was shown to be an accessible, evidence-based intervention that helped reduce common barriers to care, including time constraints, financial limitations, provider shortages, and mental health stigma. Second, although several validated tools were used across the studies, the Patient Health Questionnaire 9 was the most frequently used measure of depression severity, making it the ideal tool for this project. Third, studies consistently demonstrated improvements in depression symptoms, as well as coping skills, resilience, anxiety, and overall quality of life. Finally, researchers emphasized that self-guided CBT should complement rather than replace traditional psychotherapy and is most appropriate for individuals experiencing non-acute depression and barriers to care. Overall, the literature strongly supported web-based CBT as an accessible and evidence-based intervention for nurses experiencing barriers to mental health treatment. The theoretical framework guiding this project was Dorothea Orum's self-care deficit theory. Orum proposed that nursing interventions become necessary when individuals are unable to meet their own needs. This framework aligned well with nurses experiencing depression. Ironically, nurses dedicate their careers to caring for others, yet often neglect their own needs due to demanding work schedules, burnout, compassion fatigue, and workplace stress. The first step of Orum's framework involved recognizing a self-care deficit. Participants recognized this self-care deficit when they chose to enroll in this project. Participants then completed a self-guided CBT workbook, which promoted self-agency by teaching cognitive restructuring and coping strategies. Finally, the intervention's effectiveness was evaluated using pre- and post-intervention PHQ-9 scores with additional resources if participants needed a higher level of care. Overall, Arm's theory supported the goal of empowering nurses to take an active role in improving their mental health through accessible, evidence-based self-care strategies. This project deployed a prospective, single-group pre-test, post-test quality improvement design and was conducted entirely online. I chose this design because it best aligned with the project's purpose. This design well supported the project's aims by evaluating depression symptom severity among nurses over time using an evidence-based intervention. A pre-test post-test design allowed each participant to serve as their own comparison by measuring depression severity before beginning the intervention and again after completing the 6-week CBT workbook. Because the project was delivered online, it also aligned well with the goal of increasing accessibility. Participants were able to complete every aspect of the project remotely, from screening and consent to surveys and the intervention itself. Qualtrics was used to securely collect demographic information and PHQ-9 responses while maintaining participant confidentiality. The intervention lasted 6 weeks. Participants first completed a baseline PHQ-9 assessment and then worked through the CBT workbook independently. After this, they completed a post-intervention PHQ-9 at the conclusion of the 6-week period. Overall, this study allowed me to evaluate whether the intervention demonstrated meaningful changes in depression severity while minimizing participant burden. The intervention for this project was a free, self-guided, web-based CBT workbook. I chose this intervention because it addressed many of the barriers identified in the literature. It was free, self-paced, and accessible to anyone with internet access, allowing nurses to complete it whenever it fit into their schedules. I wanted to choose something nurses could realistically use, knowing many don't have the time, money, or flexibility to attend weekly therapy appointments. The workbook teaches evidence-based CBT techniques such as cognitive restructuring, identifying cognitive distortions, challenging negative thought patterns, and developing healthier coping strategies. Current clinical guidelines continue to recognize psychotherapy, including CBT, as a first-line treatment for mild to moderate depression. Participants were encouraged to complete the workbook over 6 weeks, and weekly reminder posts were shared in the Facebook group to encourage engagement while maintaining the self-guided nature of the intervention. The goal was not only to reduce depression symptoms, but also to equip nurses with practical coping skills they could continue using well after the project ended. The target population for this project was nurses experiencing non-acute depressive symptoms. Participants were recruited from the Facebook group known as Nurses Helping Nursing Students, which included registered nurses, advanced practice nurses, and nursing students. Eligible participants were between the ages of 18 and 89 years old and self-identified as experiencing depressive symptoms. Individuals reporting acute symptoms or suicidal thoughts were excluded from participation and were instead redirected to urgent, accessible mental health resources. Overall, 3 nurses enrolled into the project and 2 nurses completed both the baseline and post-intervention assessments. Although the final sample size was much smaller than anticipated, the participant demographics were relatively consistent. All participants were female registered nurses aged between 26 and 35 years old. 67% had been between 1 to 5 years of nursing experience, while 33% had between 6 and 10 years of experience. Regarding specialty, 2 participants worked in acute care settings, while 1 worked in primary care. Although the sample lacked diversity and statistical power, it still provided valuable information regarding the feasibility of implementing this intervention. Depression severity was measured with the PHQ-9. This tool was selected because it is one of the most widely used and well-validated depression screening tools. It consists of 9 questions based directly on the DSM-5 diagnostic criteria for a major depressive disorder, and it has demonstrated great reliability and validity across many patient populations. Participants completed the PHQ-9 2 times. The first assessment occurred immediately after enrollment to establish a baseline level of depression severity. The second assessment occurred after completion of the 6-week intervention. All survey data were collected through the Qualtrics platform. To protect participant confidentiality, identifying information was not collected. Responses were de-identified and all data were stored in accordance with the Institutional Review Board requirements securely. My original statistical analysis plan involved using the Mann-Whitney-U test to evaluate differences between pre- and post-intervention scores. However, because only 2 participants completed both assessments, inferential statistical testing was no longer appropriate. Instead, descriptive statistics were used to summarize the project findings. These included the mean, median, standard deviation, range, participant frequencies, and individual change scores. While descriptive statistics cannot determine statistical significance, they remain appropriate for describing trends and identifying clinically meaningful changes within very small groups. Given the final sample size, descriptive analysis provided the most accurate and transparent representation of the project outcomes. Although the project was originally powered to recruit 106 participants, only 3 nurses enrolled and 2 completed post-intervention assessments. Because of the limited sample size, descriptive rather than inferential statistics were used to analyze the data. As shown in the table, the mean baseline PHQ-9 score was 13.33, which falls within the range of moderate depression. Following completion of the 6-week CBT intervention, the mean PQH-9 score decreased to 5.0, which falls within the mild depression range. The median score also decreased from 18 to 5, demonstrating improvement among participants who completed the intervention. Although statistical significance could not be determined due to the sample size, these descriptive findings suggested meaningful improvement in depression severity. This graph illustrates each participant's individual PHQ-9 scores before and after the intervention. One participant's PHQ-9 score decreased by 14 points, while the other participant decreased by 13 points. The individual participant data is important because it shows that improvement was consistent among those who did complete the intervention. Although this project did not achieve statistical significance, the results demonstrated clinically meaningful improvement among participants who engaged in the project. Average depression severity decreased from the moderate to the mild range, and both participants experienced reductions of more than 13 points on the PHQ-9 scale. These findings align with the existing literature supporting web-based CBT. While this project cannot establish causation or generalized results to the broader nursing population, it does suggest that accessible self-guided CBT interventions remain a promising option for nurses experiencing depression. Another important takeaway from this project is feasibility. Despite recruitment issues, the project demonstrated that an evidence-based mental health intervention can be delivered entirely online. Given the barriers nurses face, interventions like this may help bridge gaps in access to care. Several limitations should be considered when interpreting these findings. The most significant limitation was the extremely small sample size. Only 3 nurses enrolled and 2 completed the project, substantially limiting statistical power and preventing inferential statistical analysis. Second, participant recruitment proved much more challenging than anticipated. Although multiple recruitment posts, extended recruitment periods, and weekly updates were utilized, participation remained limited. Recruitment through a single Facebook group may also have introduced self-selection bias. Participants who volunteered may have been more motivated to improve their mental health or more comfortable engaging in online interventions than the broader nursing population. Additionally, recruitment through social media limits generalizability by excluding nurses who are not active on those platforms. Finally, long-term outcomes such as sustained improvement could not be evaluated. Although this project involved a very small sample, it highlights several important implications for nursing practice. First, the findings support the potential value of accessible, evidence-based mental health interventions for nurses. One of the greatest strengths of a web-based CBT intervention is its accessibility. Nurses often face unique barriers to care. Because this intervention is free, self-paced, and available online, it addresses many of those barriers while allowing nurses to engage in treatment on their own schedule. Second, healthcare organizations may benefit from incorporating similar interventions into employee wellness initiatives. Offering evidence-based mental health resources can improve nurse well-being, reduce burnout, increase resilience, and enhance staff retention and patient care outcomes. Finally, this project reinforces the important role nurses play in promoting mental health, not only for patients, but also for one another. Supporting nurses' mental health is an investment in the overall quality and safety of healthcare delivery. In summary, this QI project evaluated whether a self-guided, web-based CBT workbook could reduce depression severity in nurses. Among participants who completed the intervention, depression scores improved substantially, with average PHQ-9 scores decreasing from moderate to mild. Although the small sample size prevented statistical analysis and limited the generalizability of findings, the observed improvements were clinically meaningful and consistent with current literature. More importantly, this project demonstrated that an evidence-based intervention can be implemented in a flexible, accessible, and low-cost format that addresses many of the barriers nurses face when seeking care. Ultimately, improving nurses' mental health benefits not only the individual nurse, but also patients, healthcare organizations, and the profession as a whole. This project has been very meaningful for me. I knew I wanted to focus on a topic that would make a difference for nurses. Throughout my career as a psychiatric nurse, I've seen colleagues experience stress, burnout, compassion fatigue, anxiety, and depression, often while continuing to care for others without prioritizing their own well-being. Completing this project strengthened my understanding of evidence-based practice and quality improvement, but it also reinforced the importance of advocating for the health of our healthcare professionals. As a future psychiatric mental health nurse practitioner, this experience has influenced how I think about improving access to care. It reminded me that effective treatment doesn't always require complex or expensive solutions. Sometimes increasing accessibility and reducing barriers can have a meaningful impact on people's lives. This project has also strengthened my confidence in critically evaluating research, implementing evidence-based interventions, and leading future QI initiatives. Most importantly, it has reinforced my passion for promoting mental health, reducing stigma, and advocating for both my patients and my colleagues throughout my career. Based on the findings and limitations of this project, several recommendations can be made. The first recommendation is to recruit a larger, more diverse sample to improve generalizability and enable inferential statistical analysis. Future projects should also recruit nurses from a wide range of areas rather than relying on a single social media platform. Additional strategies to improve recruitment and retention may increase participation. Future studies could determine whether improvements in depression symptoms are sustained over time. Researchers may also evaluate additional outcomes such as burnout, resilience, job satisfaction, absenteeism, turnover, and quality of life to better understand the broader impact of this intervention. Finally, comparing self-guided CBT with therapist-guided CBT or other evidence-based interventions may provide additional insight into the most effective approaches for supporting nurses' mental health. This concludes my presentation. Thank you for your time and attention. I would be happy to answer any potential questions. And here are my references. There are 2 pages. I hope you have a wonderful summer. Thank you again.